Having a job is important, but professionally in a job is twice as important. We should always remember that having a job is to survive in this world, but being professional is another thing. Being professional doesn't mean we have to be perfect at our job, hence to be the right person for that job. We should always remember to respect, show kindness, honesty, confidentiality, and a positive outlook that will help our clients to be happier and assured. Being professional doesn't mean we don't have any flaws or mistakes. We do have mistakes, but it is our responsibility to correct them. We cannot turn back time and correct it, but instead we move forward and try to take responsibility because in that way we can repent and be forgiven. Upon entering the emergency room,
Oh
Sunwon and
my,
her best friend
this place
Sango
is too
was
crowded
greeted
and
by the busy
chaotic.
atmosphere. Nurses were moving around, patients demanding immediate care, and doctors diagnosing patients.
Yeah, everyone seems to be very busy. Where are we supposed to go?
I guess we have to ask the nurses here.
Okay, let's go, Rai.
Taking a step forward, she halted when her best friend Sango almost lost her balance because her legs seemed to be wobbly. Later on, a nurse named Sobrakari, who was assigned at the information area, saw the incident.
Are you alright? Can you walk?
And I can't take another step anymore. My surroundings are spinning before my eyes.
Oh my! Nurse Texon! Come here. The incoming patient is waiting outside the emergency room and it seems like falling down anytime soon, so perhaps maybe you can offer her a wheelchair?
Okay, wait for a while. I'll just grab a wheelchair first.
Sango, even in her dizzy state, was feeling anxious with the thought of nurses and doctors. Her heartbeat doubled. Sweats formed on her forehead. When she lay down in the hospital bed, she felt like throwing up. Added by the brightness of the light above, it made her dizziness even more palpable. She kept on blinking and moving to each side of the bed to find a comfortable position when a nurse greeted them together with her best friend, Sunwon.
Good morning, ma'am. How are you today?
I am sorry to interrupt, but my friend is not in the mood to talk because she is not feeling well. She told her headache. You can refer and ask me questions on behalf of my friend and I will gladly answer.
Yeah. Okay, so I am Nurse Subukari and I will be needing the patient's personal information for health assessment. So, will that be okay with you po? So, the patient's consent is very much needed.
No problem, nurse, for as long as my friend's information will be kept confidential and used for the extent of its purpose.
Rest assured, ma'am.
When Nurse Sobrakari was to ask the patient's name through Sunwon, Miss Sango groaned from pain.
Is there anything wrong, ma'am?
Oh my head.
Rizal, it's okay. Tell the nurse what you feel so that she can help you. They will help you ease your discomfort. Didn't you tell me you were feeling dizzy?
Nurse Sobrakari waited for Miss Sango to confirm it. Suddenly, Miss Sango's eyebrows furrowed when she was having a hard time focusing her eyes. Her dizziness worsened, yet she was anxious enough not to tell the nurse about her condition.
Are you still feeling dizzy, ma'am? Can you please rate your dizziness from 1 to 10? 1 for no pain at all and 10 for worst pain.
Miss Sango felt scared. The reason she refused to answer the question, what if she's having a serious illness? Will they have to open her up? But the moment Miss Sango covered her eyes away from the light, Nurse Sobrakari got the message. She made her way to the side and adjusted the light specifically where the patient was.
Mom, is the light adding up to your dizziness? I'm sorry, you could have asked one of our nurses to adjust it for you right away.
Thank you, nurse.
Nothing big, ma'am. Your comfort is our top priority.
From the words assured by the nurse, the patient felt relieved and comforted. although the anxiety was still there. The vibrant aura of the nurse and how she spoke to her calmly and slowly lessened it.
Before I forgot, Mom, since you are the guardian, you have to fill up a form on the information area. Will that be okay?
I will leave you for a while. I need to fill up that first.
10 minutes later, Sun Juan came back. A while ago, the nurse who talked to her then helped to assist the patient on the next bed because of lack of manpower in the hospital. Now it appears like they have to wait for their turn. By doing so, Miss Sango fell asleep.
One eternity later.
Ma'am, I will be interrupting your sleep. After that, you can rest. Okay? So, ma'am, this is me again. I'm Nurse Subikari, and I am the nurse a while ago. So, today, ma'am, I will run a health assessment for you to check if there's any abnormality to note. And after a minute or so, the doctor will arrive to check on you. Okay po ba yun, ma'am? Naintindihan po ba natin? Don't worry, ma'am. I've also briefed your friend about this, and she shared with me about your anxiety with nurses, doctors, and hospitals, and it is totally fine and understandable. Instead, we will work hard to make you feel comfortable with our care, okay? Don't hesitate to tell us something about what you feel, okay, ma'am? Okay, so ma'am Sango, when did your dizziness start po?
It started last Tuesday. Miss Leonardo said 2 days from now.
Hey, ma'am, so do you have a headache or are you just simply feeling dizzy?
I do have headache. It results in me being dizzy. My headache is actually extreme.
Oh, ma'am, can you point out to me what part of your head hurts?
The right side of my head hurts.
Ma'am, how long do you experience this po?
I've been having a headache before, so I thought this will pass by. But my dizziness became a normal thing to me, so I always sleep the pain away. But this is the time where my dizziness became uncontrollable and I fell down on my knees a while ago.
You fell, ma'am?
It really hurts.
Okay. Okay, ma'am, so how severe is your headache and dizziness? Can you please rate it again from 1 to 10, which 1, no pain at all, and 10 with the worst pain?
Most probably 8.
Okay. Ma'am, so what makes it worse po?
The light directed to my eyes, it makes it worse. Also, every time I try to get up from lying down, my head spins, making it harder for me to open my eyes. I feel like throwing up when this happens. It really hurts my head.
Do you eat on time or maybe stay up late, ma'am?
My friend eats late most of the time.
Oh, okay.
She's very hard-headed. She doesn't rest and always stressing about random things. This could be a factor, right, nurse?
Could be, ma'am. But it's better for you to talk this out to the doctor.
When Nurse Secretary got the information area to ask about the doctor appointed to Miss Sango, there was a problem. The said doctor was busy enough to accommodate ER patients, but it surely referred to Doctora Malake to them as a substitute. Nurse Secretary called the doctor right away through the hospital phone.
The MSF Hospital, this is Nurse Subikari from ER. Is this Dr. Malake?
Hello? Oh yes, this is Dr. Malaki. I am currently making round at St. Anna's ward, but I'll be going down to the ER after this, so give me 10 minutes perhaps, okay? Also, can you tell me later about the nurse assessment so that I will have a glance of the patient's condition, please?
Okay. Noted po, Doc.
Okay, thank you so much. Bye!
Inside the ambulance was Miss Thelma, who met an accident on her way home to the company where she's working. Her car crashed into a truck and the impact made her lose consciousness.
Nurse, do you have a patient named Liza May Tamo? Someone called me and brought me say that my cousin was brought here in after the accident.
Okay, sir. Just wait for me.
May I know her condition?
Miss Telmo is sleeping now. However, she had a head injury from the impact of the accident.
Did the doctor check on her?
Yes, sir.
Hey, Mr. Bauer, can you hear me? Mr. Bauer, can you hear me?
Nurse Ahad, call Dr. Malaki right now.
Right away po.
Nurse Abercary, please help me assist patient Tomo.
Yes, ma'am.
Hello?
Good afternoon, Dr. Malaka. This is Nurse Ahad from DMSF. Doc, we have an emergency right now. Patient Tamo, who's the one who got a head injury, is having a seizure right now.
Oh, okay. Got it. I'm on my way. Yeah. Bye.
Doc, good afternoon.
Good afternoon, sir. Are you the guardian of Miss Telmo?
Yes, I'm her cousin.
Oh, okay, so your cousin did have a seizure a while ago. It lasts for 3 minutes, as said by the nurses. So by then, I'll have to do an assessment to further know the condition of the patient. So with that, the patient has to undergo CT scan and some series of blood tests. So her vital signs are monitored from time to time. What else? Do you have any questions, sir?
Will my cousin stay overnight in the hospital?
Okay, so it will depend on her condition. In the meantime, as I've said, she'll have to go through a further.
Okay, thank you, Doc.
Okay, no problem. Welcome.
After 2 days, there was an emergency. Both patient, Miss Sango and Miss Thelma needs immediate help, and the only attending physician present is Doc Malake. Both the patients are transferred to the ICU while their families are outside the room.
Nurse Supercurry, Nurse Dixon, what happened?
Doc, Miss Sango fell from the stairs and hit her head while walking on the way to the chapel on the second floor.
Dr. Malake became alert and asked the nurse to orient her about the patient's conditions. Unfortunately, in the case of patient Telmo, they found out that she earned internal bleeding in her head, the reason she was rushed to the hospital an hour ago. Thankfully, she had surgery immediately. For patient Sango, the patient sleeps on stairs, and when her head bumped on the cold tiles, her head bleeds.
A few moments later.
After praying, the nurses left the chapel and were a bit curious because they saw the families of the patients running close to them and they saw the miracle. Patients survived the most challenging time of their lives. Life is full of surprises. When we say that we know life very well, are you sure? Have you really truly known it? Do you know everything? Nobody's really certain, and no one really knows everything about it and its people. People make decisions, and it's up to them to choose and decide, and also to discover. And what is professionalism in connection to values? Professionalism is a norm of conduct wherein officers and employees perform and discharge their duties to the highest degree of excellence. such as competence, intelligence, and skills. Professionals should always learn and have these basic values in terms of respect, kindness, honesty, dignity, stance, and unbiased, and learn to keep confidentiality, positive, and open-minded. As an overview of the story, this will depict how busy the hospital is together with the doctors and nurses. However, no matter how hectic and demanding their profession is, they are facing their responsibilities with a passion to care for the patients and being true to their oath. This will show different emotions and top points of views that are mainly human nature.